because I promise you, in the real world, they're not trying to see what your GPA was, how many times you had to take the NCLEX, why you was late to going to class, and hey Nursebae, welcome back to my channel. I missed you guys. As promised, I wanted to give y'all some nursing school tips, some ways that you could pass your test easier, some ways that you could pass the NCLEX easier. Because what I really want y'all to have is more confidence going to school every day and knowing that if you're just starting the nursing program, that you can do it too. It's not nothing that you can't do, but I want you to know that this journey that you're in or that you're about to embark on is going to be hard. It's going to be transformative. It's going to be challenging, and it's really going to be up to you to make sure that you're getting the things that you need to make sure you have the success that you desire. Okay? The first tip that I really wanted to go into as far as nursing school study tips is to find out your learning style, okay? It's really going to help you to retain the information, because what I found out when I was in nursing school is that I was studying by reading the books, but I really couldn't understand like why I was not passing the test. So me personally, I am the type of person that needs to learn by doing. Be writing your notes, using flashcards, using a tape recorder, things that will have you actually doing and putting the work to work will help you to retain the information for your quiz. Picasso. So the next thing that I really wanted to tell y'all about is to pay attention to the different instructors' teaching style. In these lectures, sometimes the teacher will be like,
patient is in Fowler's position. Fowler's position is the way that the patient needs to be in. So make sure that you're putting the patient in Fowler's position.
when an instructor, a professor, a teacher, anybody that's teaching you something or giving you a lecture, if they say something more than one time, I guarantee you that's going to be on the test. Okay, instructor even said the color blue 3 times. I'm gonna write the color blue on my study guide, because I guarantee you it's gonna be a trick ass nursing question that's gonna be like,
what color did the patient have on when he came into the hospital, even though he got a hospital gown?
And the multiple choice might say blue. And it's just little tips like that. So pay attention how your teacher, your instructor is teaching you guys, and the things that they are saying 2 times, 3 times, 4 times. They are giving you hints that that's going to be on the test. Sure that you're using your study guides. You know, sometimes we just think that the teachers and instructors are passing out papers willy-nilly. These things that these people are doing is very strategic so that you will be able to learn, retain, practice, and study. Okay, as a professional, make sure that you're keeping your study guides, you're looking at them, and you're taking note if anything is different from your lecture notes in class. Okay. Next thing I wanted to mention is when you are taking these tests, you know, they have these long form questions. You know, they be like,
when you walked in the room, it was blood everywhere, and the patient was in the bed, and you couldn't figure out what was going on. But 2 days ago, the patient had got a hip replacement, and it's a Foley in, and the Foley bag had got kinked because he was in a physical therapist. What's the first thing that you would do?
You're on the NCLEX. Whenever you're trying to figure out what's the right one, through process of elimination, you think about yourself as already being the nurse. When you are answering these questions on the quiz, stop adding all the extra stuff, because sometimes what we like to do is be like, but what if he cut his ankle on the bed and he bled out on the floor, and we don't. If the question don't have nothing about a skin tear, don't add no skin tear in your answer. Okay, so you are the nurse that is taking this test, that is taking the NCLEX, and you have to make sure that this patient survives. So what is your answer going to be? A, B, C, or D? Last but not least, you're going to pass the NCLEX. Okay? Let's get that out of your head. You know, we really have to go into these situations being positive, knowing that if we made it all the way through nursing school, there's no way at all that you will pass the NCLEX. If you use these tips, even though it's 5, these 5 tips, I promise you, it will take your grades from a C to a B, from a B to an A, and you'll be walking around there like NurseBae. You have a different level of confidence, y'all. You've been in nursing school. You've been through this. ABCs. Airway, breathing, circulation. Look at your questions, and you need to prioritize as the nurse. So after you take this NCLEX, after you take this exit HESI, this entrance exam, you are going to be the nurse. You're going to be this person that's going to be in charge of somebody's life, somebody's comfort, somebody's family member having a good or a bad day. So how will you show up? Because sometimes people don't take it serious as it really is. Yeah, you probably made it through nursing school by the skin of your teeth. I get it. But don't let the tests, the quizzes, the grades make you feel like you're not going to be a good nurse, because I promise you, in the real world, they're not trying to see what your GPA was. In the real world, your patients are not going to care what you packed for lunch the other day and who you got into an argument with and why you was late to go into class and how many times you had to take the NCLEX. All these people are going to care about is you showing up for them, you taking care of them, and you advocating for them. And that's what's really most important. The truth is, I really just want this information to get out. I really want y'all to be successful in your nursing career, and not only that, successful in life. You know, soon we're going to be talking about some life skills, some life things, my lifestyle, your lifestyle, how it is to exist outside of nursing, and who you are outside of the hospital. Who are you outside the nursing home? So thank y'all for watching this video. Give this video a thumbs up if you want more content like this, and comment below a question that you have, a study tip that you may want to share with a fellow nurse, or really just say hey, because I'm in the comments too. Until next time, bye.